Today's workshop is about Vermont ABLE, how to save for disability-related expenses. I'm excited to introduce you to Kirsten Murphy, the Executive Director of the Vermont Developmental Disabilities Council, where she has worked since 2013. She began her career in nonprofit management in the 80s, developing programs for high-risk youth in New York City and Boston. Her interest turned to disability rights and community inclusion when 2 of her children were diagnosed on the autism spectrum. Kirsten founded a family support program, ARCH, serving the Upper Valley region of New Hampshire and Vermont, directed the New Hampshire Autism Council, and is credited with securing equitable insurance coverage for New Hampshire children who experience the interfering symptoms of autism. She is a 2010 graduate of the Leadership in Neurodevelopmental Disabilities program, also known as LEND, through the University of New Hampshire. She brings over 3 decades of experience in public policy, systems thinking, and advocacy. Thank you so much for joining us today. Thank you, Kirsten, and I will turn things over to you.
Thanks so much, Jamie, and welcome everybody. It's great to be here. I really appreciate you all taking some time on a very rainy day to learn a bit more about how the ABLE savings program can help you, and specifically Vermont ABLE. So I want to point out that we're kind of in the middle of migrating our brand a little bit. So I've put both logos on this first slide, but the not my favorite, but the company, one of the companies that we work with, has insisted on a more generic logo. So that top logo with the outline of the state is the brand that you'll see when you will be showing you the links to the Vermont ABLE program. So let's go ahead and switch up the next slide. And full disclosure, I like to be sure that everyone is aware I am not an attorney. I don't play one on TV like this gentleman either. I am also not an investment counselor. What I am is somebody who's been working around the federal legislation that created ABLE savings, and then helped Vermont launch its state program. But I do strongly encourage anybody who wants to get into this more deeply, if there are legal or technical questions and you have an attorney you can access, that is the best person to go to. Although ABLE is designed to be simple and really should be, you shouldn't need that level of expertise. If we could go ahead to the next slide. What we're going to talk about today is the background of how ABLE came to be, and then some recent updates that Congress has enacted, how to put ABLE to work, so how to open an account, and then some important rules to know. Next slide, please. So background, we'll start there. Go ahead and give me the next slide, and we're going to talk about the Achieving a Better Life Experience. That's what ABLE stands for. This was created and passed by Congress in 2014 after literally 10 years of advocates tromping up the hill to try to enact a new type of savings opportunity that was specific to families and individuals that had a significant disability. It has always enjoyed widespread bipartisan support, but I guess it's just the nature of federal legislation that it takes about 10 years to move even a really good idea through the process. ABLE was updated in 2020 to expand eligibility. I'll be talking more about those specifics. ABLE creates tax-advantaged investment accounts for people with disabilities. So tax advantaged is not the same thing as tax-free, but it does create some opportunities to save in a specific type of account where the earnings or interest in that account are not taxable at the state or federal level. Probably more importantly, ABLE accounts allow you to shield savings, or sometimes called assets, in a manner that doesn't affect eligibility for federal means-tested benefit programs. So programs that ask you, how much cash on hand do you have? How much property do you have? That's a means test. It's different from how much do you earn, which is an income test. So it shields you from having to report savings to certain federal programs, most importantly, SSI, Social Security income, and Medicaid. So, and then the other thing I just like to point out is, confusingly, ABLE is an amendment to IRS codes. It's actually a piece of tax legislation. It's based on the same type of program that you might know of as a 529 college savings program. And the argument that a lot of us made when we were talking to congressional offices about this was, hey, it's not fair that a family can save in a tax-advantaged way for someone to go to college someday, but there isn't a similar benefit for someone who might have significant disability expenses. We should allow families to save for that. That could include college, but it might include a lot of other things. So what you can spend money in your ABLE account on turns out to be quite broad. The IRS interpreted the federal rules in a really generous way. Next slide, please. So since 2014, all but 8 states have created ABLE programs. The federal law said states have to stand these programs up. And also what happens with federal laws is every impacted agency then has to write something called administrative rules, which are the details of how that new law is going to be implemented. And it took about 5 or 6 years to get all the impacted federal bureaucracies to write their rules, but those are all now in place, and we can be very sure about how ABLE is operating. Over time, ABLE has increased the deposit limits, which is a good thing. It's kept pace with inflation. And now more than 112 million Americans with disabilities have about $1 billion under management through the various ABLE programs across the country. One of the concerns that advocates have is that's actually not enough people. It's a great program. And for it to stay affordable and strong, it needs, we want the word to get out. We want more people to take advantage of it. Next slide. So Vermont ABLE is the brand name for the program that Vermont chose to stand up as its state ABLE program. The legislature in 2015 charged the Vermont Treasurer's Office, then run by Treasurer Beth Pierce, to develop Vermont's program. Now, the reason you see up at the top of this slide and have been seeing this funny word stable account, it can be confusing of the branding here, is that a group of stakeholders in Vermont spent a deliberative process to decide what was going to be the best way for Vermont to stand up a program. And because Vermont's a really small state, we didn't have enough numbers to keep a program just for Vermonters and make it affordable. So we chose to partner with the Office of the Treasurer for the state of Ohio, and Stable is Ohio's brand name. There are, 14, I think, states now that are part of the Ohio Stable program. So all the back office mechanics of the program are run by the Ohio Treasurer's Office under a contract with the Vermont Treasurer's Office, but we're allowed to brand our program and our website specific to Vermont. And the Treasurer's Office monitors this relationship really closely. And if we ever felt that the Stable program wasn't serving Vermont well, we could migrate it to a different arrangement. But we think that we're best served that way. We've been operating since 2017. Both the council and the Treasurer's Office monitor the program. There has been some changes in the vendors that Ohio hires to run its sort of central website and some other customer service functions. So again, I actually meet quarterly with the Ohio Treasurer's Office and all the partner states to make sure that we're continuing to get the service out of Ohio Stable that we want for our Vermont customers. Next slide. So why did we choose Ohio? And that's Treasurer Pierce, who has really she was just so instrumental in setting this up. We chose it because it had the lowest fees, it had the strongest customer service, and it had pretty good investment options without having like lots of different confusing investment options. We'll talk about the 5 options that are available through this program. But they're pretty basic and they're pretty solid, and it's not me that passes that judgment. Again, the treasurer's office, it's no longer Beth Pierce, I'm forgetting who our treasurer is now, but the treasurer's office monitors that investment portfolio, in a professional manner. Next slide. So full disclosure, yes, I do promote Vermont ABLE, but Vermonters are allowed to enroll in other ABLE programs that certain states have created and opened up nationwide. So for example, Florida was one of the early states to do that. Florida's ABLE program is open to anyone in the United States. Tennessee's is you'll see a lot of states listed on this slide. And there's also another national consortium called ABLE Alliance that has 17 states participating. The difference, and there's nothing necessarily wrong with any of those programs, is that the Vermont Treasurer's Office and the DD Council do not monitor that program. So we stand by Vermont ABLE and we monitor it closely. These other programs may be of interest to somebody. Say you're a hotshot investor and you really want a lot of options in investment opportunities. You might find more options in one of these other programs. There's a link on this slide that'll take you to a tool that the ABLE National Resource Center has created to let you compare the different programs. But again, we feel really confident that Vermont ABLE is a well-monitored program. Next slide. So how to put ABLE to work for you, which is what you really came here to find out. Next slide. So why would you want an ABLE account? ABLE is a really unique opportunity the federal government has created. It's one of the few programs I can think of that has addressed the problem in our social safety net that people are expected to impoverish themselves before they can access public benefits. That's generally kind of the way our social safety net works in the United States. And ABLE is a program that does not expect people to impoverish themselves. It tries to help people not do that. So it's a very empowering program. The way ABLE is set up, the person with the disability is the owner of the account. Now, they may have guardianship and other arrangements, so decision makers are operating the account, but the asset is owned by the individual with the disability. And we haven't, as a nation, been particularly generous about allowing people with significant disabilities to have assets in their own name. It also provides an opportunity for families to teach financial literacy through some of the instruments that are available in the ABLE account. It becomes a really good way to help a loved one in your family learn how to use money more effectively. And finally, it takes a population of people that was essentially under or unbanked, we call it, just had no access to the banking system, and it gives them the first time in their lives an opportunity to really save. Next slide. So there are significant financial benefits, and here's the most important one. You will be familiar with the $2,000 cliff in Social Security income. If an individual, an adult, is receiving Social Security because of a lifelong disability, and they have more than $2,000 in their name, their Social Security is suspended. And we used to hear stories all the time from self-advocates who would literally have a case manager from the designated agency or someplace call them up and go, yo, you're about to go over your $2,000 limit. You got to spend some money. Go out and buy yourself some clothes or something. I don't know. I mean, it was just completely irresponsible way to handle money. It encouraged sort of buying things you didn't necessarily need, and it didn't encourage people to save for longer term things that might be important to them. Say you're an individual who wants to have an extra week of summer camp, and that's something that you really look forward to, and you had a way to save up for that. With this $2,000 cliff, people really didn't have an opportunity to do that. So money once it's in the ABLE account cannot be counted by Social Security as an asset in your name. As I said, it's also tax advantage. The interest that is earned on the money you deposit in ABLE is not taxed, either by the state or the federal government. Next slide, please. So, I think we might have jumped. Yeah, okay. So eligibility. There is an eligibility quiz at the Vermont ABLE website. Some of the basic rules: person can only have one ABLE account. And here's the one that has been up for a lot of debate. Under the original legislation, the onset of the disability had to be before the age of 26. That was really a compromise that people advocates agreed to, because there were legislators in Congress holding out for fear that this would become too widespread, and they wanted to rule out people, especially with mental health conditions that often have a later onset. Ever since 2014, advocates have been lobbying Congress to adjust the age of onset upward. And effective January 1 of 2026, under the ABLE Age Adjustment Act, people can have an onset of a disability and still be eligible if it occurred before the age of 46. 46 is an incredibly arbitrary number, nothing special about it, but consensus developed around that number, and it seems to capture people with adult onset serious mental illness, veterans, and people with later onset neurological conditions like MS. And then to use Vermont ABLE, you have to be a Vermont resident. Next slide. There are several paths to eligibility, specifically 3. Most people qualify for an ABLE account because they receive SSI or SSDI. That automatically makes you, as a person with a disability, eligible for an ABLE account. If you don't happen to be collecting SSI or SSDI, I have a son with autism who works, so he wouldn't necessarily be doing that, or doesn't do that, but he has a condition that is clearly listed in the Social Security Administration's list of compassionate allowances. That would be another way to say that you know that you're eligible. And then another route, and this is the one my son uses, is self-certification. An individual can collect a letter from a licensed physician and keep that letter on file themselves. You do not have to send it to Ohio. The last thing Ohio wants to do is weigh in on people's eligibility. Like a lot of things in the tax code, there is an assumption that you are telling the truth. And so as long as you have that documentation in your possession, if you were ever audited, that's the check and balance here. Now, they've never audited an ABLE account so far, but the check and balance is you could be audited, and so you should have that documentation, but you can ask a physician to self-certify or certify an individual as eligible. Next slide. So if you are self-certifying, a good guide is to use the Social Security's Blue Book, which is an exhaustive list of various physical or mental impairments that cause quote marked and severe functional limitations. That's the guidance that the IRS, the Social Security Administration adopted in order to describe eligibility in more detail. That condition has to last for at least 1 year, and you should have the physician's name and address on that letter. Next slide. Enrollment is actually incredibly easy, but you don't go down to a bank to do this. They'll look at you like, what are you talking about? Like a lot of investment opportunities, enrollment is done online. There is no specific fee to enroll. It takes about 20 minutes. I've helped other people enroll, and that's about the right amount of time. And you do need a $25 minimum opening deposit. So the individual themselves with a disability can do this, or a family member if we're talking about a child, or somebody who is what's titled an authorized legal representative can open an account for someone. And there's some fairly specific rules around who can be an authorized legal representative that I have another slide to show you about. Go ahead and advance. Yeah, there it is. Okay, so the authorized legal representative can be someone who holds a power of attorney for financial decision-making. It can be a legal guardian, somebody who's been appointed by the court. It can be a spouse, parent, sibling, grandparent, or finally a representative payee, who is somebody who's officially allowed to accept somebody else's Social Security money. What's important about this is a hierarchy. And so the person highest up in that hierarchy should be the authorized legal representative. They're going to be telling the ABLE people when they sign up, hey, we're the person with the highest up in this list that can be the authorized legal representative for someone, and there's nobody higher up in that list that's willing to serve in that capacity. This is a detail that gets people often have questions about it. At the very bottom of the homepage for the Vermont ABLE account, down in the bottom, there's something called the plan disclosure statement. And that is a 113 pages. It's extremely detailed, but it includes a very clear description of authorized legal representatives. It's kind of all the details that if I have to answer a really complicated question, that's where I go. Next slide. So funding your account. You can deposit a check. You can also do it by electronic transfer. And right now the annual limit is $17,000 a year. So if someone has $17,000 a year, that's good. That's a really good thing. That can be ABLE accounts are used in a couple different ways. What the advocates originally thought they would be used for would be families saving for children who the family knew would have a lifelong disability. So they open an account when the child is 5, they put away $17,000 a year. By the time that child, similar to somebody who might be going to college later, by the time that child is an adult, there's a significant nest egg that can be used to help with the transition to adult expenses or other things along the way. But the other group that uses ABLE accounts, however, are people with disabilities who are adults and are earning money and don't want to fall off that $2,000 cliff and have their SSI going in and out of, turning on and off and that sort of thing. So it's also, and advocates didn't anticipate this as much, it's also become a tool used by adult wage earners who have significant disabilities. There's a list here you see of all the different ways that you can fund an account. You can send your wages into the account, or a parent can send money that they earn. You can have grandma give a gift directly to the account. It will actually even send reminders to say thank you. You can take distributions from a special needs trust or pool trust and also put them in ABLE. You might choose to do that in order to move the money into the ownership of a person with a disability, or you might choose to do that because ABLE accounts are a lot more flexible in terms of moving money in and out. And then public benefits that are not needed immediately. What comes to mind is when everyone was getting stimulus checks, people with disabilities also got stimulus checks. And some of those checks were big enough that they would have put someone over that $2,000 limit. We saw a lot of folks opening new ABLE accounts because they wanted to shield that particular public asset so that they wouldn't lose their Social Security. Next slide. And so as an added benefit, ABLE is a pro-employment program. It really is part of the legislation, is the idea of wanting to promote wage earning by people with significant disabilities. So there is an added option that if you are depositing, you are a person with a disability, and you are depositing your own wages, you can add an extra $13,500 on top of the $17,000. So that doesn't happen for a lot of people. People with disabilities don't typically have that much money, but it is an added sort of pro-employment benefit. It might be that somebody had a family or a trust that was able to transfer money for the 17, and then they put 13 additional $1,000 of earned income in there. This assumes and is intended to make up for the fact that you would have to be eligible for this added maximum. Your employer cannot be contributing to a 401 or 403 plan. So again, very technical detail. Next slide. So how is the money invested? When you sign up for ABLE, you have 5 options, and 4 of them are different Vanguard accounts with different levels of risk involved. And typical of investment products, the more risk you assume, the higher potential return. So they kind of range from very low risk to a more aggressive type of account. And depending on how long I'm not an investment person, but depending on how long you're planning on sitting on that money, you might make different decisions about the level of risk you're comfortable with. What 3/4 of Vermont ABLE holders choose to do instead is they put all their money in the 5th option, which is an FDIC insured option that is principal protected. So it is federally insured. It operates sort of like a checking account. So you don't earn as much interest on the money, but you know that your principal is always protected. And if people don't have strong feelings or really want to engage in actively managing investments, I often recommend that they stick with the FDIC insured option. Next slide. So here's the best news about ABLE. What can you spend the money on? The IRS surprised us all by casting a really wide net. So to take money out of your ABLE account, you need to spend that money if you want to continue to maintain the types of protections that it's had from taxes. You must spend it on a qualified disability expense. That is anything related to your disability that helps to maintain or improve your health, independence, or quality of life. That's housing, basic living expenses, assistive technology, transportation, post-secondary education, burial expenses, employment support, legal expenses. It is a really wide range of opportunities. There are very few things that there isn't an argument to be made that they improve your health, independence, or quality of life. So if we can pop to the next slide, I got a little quiz for people. Now y'all are going to have to work. You can, I think you're allowed to just chime in to the answer to this question. So here's some possible expenses. Food for my Chihuahua, Bixie. Is that an eligible expense? I'm a person with a disability and I need to buy dog food for my Chihuahua, Bixie. Is that eligible? Come on, people.
Yes, if it makes them happy.
Yes, it's totally, it's a household expense. Yes. How about a gym membership?
Yes.
Yes, because it supports your health. How about a personal trainer named Igor?
Yes, it improves your health.
Yes, it supports your health. Okay, I want to take a vacation to Iceland to visit the hot spring. Is that an eligible expense? Somebody sent this question in, but not in as much detail when they signed up. A vacation. What do you think? I'm seeing a nod.
Seems like it would improve health and well-being.
Yes, it is. Yes. And here's some things to think about. Your airline ticket, your hotel room, those are all legitimately, supporting your well-being. That's arguably an eligible expense. Taking a direct support provider who's going to help you is also an eligible expense, as is their airline ticket. But if your sister wants to come just because that's fun, that's a gift to your sister. She's not there to support you, so that's not an eligible expense. The only things that really aren't eligible are gambling and buying a gift for grandma. If you buy a gift for someone, that's not an eligible expense because it's not about your well-being. All right, that was our fun little quiz. Next slide. So what happens if you made a mistake and took some money out of your ABLE account and bought your mother flowers for her birthday? So that means that the expenditure is now considered a countable resource. So technically you would have had to tell SSI that you had this money in your account at some point. And you might pay a small tax penalty on the earnings portion of the withdrawal. Basically, this hardly ever comes up. It's very technical. Basically, you just shouldn't buy gifts because you won't get into trouble. But you're not going to go. My point is, you're not going to go to jail for it. It's not like that serious an offense. There's a small penalty, but that's about it. And as I say, none of these accounts have been audited so far. Next slide. So withdrawals are free. There is no limit. And Vermont ABLE is, again, the Ohio Treasurer's Office does not want to pass judgment on what you're spending the money on. This, again, is one of those places in the IRS tax code where they are assuming that you are telling the truth. You should keep documentation of what you are spending the money on. So the easiest way to do that is to use some kind of electronic transfer. So you have a record that's automatic. And I'll be showing you the stable card in a little bit. Stable cards, which kind of like sort of like a credit card, that also automatically creates a record for you. So you can ask your stable, you can ask the Vermont ABLE to pay a bill by writing a third-party check. It's a little bit cumbersome. The customer service agency that's now working for Ohio has made this a little more difficult. So if you have the option to just pay a bill by electronic transfer, that would be a good idea. For example, say you know that you want to pay your son with a disability's rent every month. You would set it up as an electronic transfer. It would be a lot easier than using a third-party check. And then I'm going to talk about the stable card in a minute. Next slide. The stable card. So this is one of the things that really sold us on what Ohio could do for us. It looks like a credit card. It's not. It's a loadable debit card. It acts more like a gift card. You have to make a conscious decision to put $100, say, on your stable card. A lot of families use this as a way to teach budgeting skills to a young person. So you get $100 a month, for example, preloaded onto your stable card. Actually, there's some options to also put some limits. Say, for example, you know that your daughter is like super, like she just can't resist spending money on comics. And there's like this comic book store that she like will waste all her money. You can actually have that vendor disallowed on the stable card, for example. You could set it up so it's only usable at grocery stores, another option. So there are ways that you can set some limits on this. And the really important thing is because it's preloaded, you're not gonna like pull all the money out of your account, right? You're not gonna overspend. It creates a hard stop. Once you've spent the whole preloaded $100, the card won't work anymore. Also, you're not allowed to take the card to a bank and draw down cash from your preloaded money. The card can send text alerts to the parent with the beneficiary's permission or the guardian's permission to let you know that, your son Max just spent half his monthly stable money or whatever. So that can become an opportunity for a conversation. Unfortunately, the new vendor in Ohio also started to charge for ABLE cards, the stable card. And our Vermont treasurer said, no, that is not what we promised people. So the Ohio Treasurer's Office is now automatically paying the $5 a month fee for the card for any Vermont ABLE holder. So that's kind of a nice little benefit there. So this continues to be a free option for people. Next slide. So yes, like any account, there are fees. So if all you're going to do is sock away $100, ABLE is probably not a great idea because eventually the fees will erode it. It's a $3.50 a month fee As I said, the stable card fee is $5, but the treasurer's office is covering it. And then if you happen to engage in some of the investment activities through any of those 4 Vanguard accounts, there's a percentage that Vanguard takes on that, and that's how Vanguard makes its money. Next slide. And the asset-based fees are really quite low by industry standards. That's what. Next slide. So how is ABLE doing? As of May, there were 930 people enrolled. Vermont's ABLE program actually has, of the accounts that I can track, the highest per capita utilization of any state. So there's some, I don't have the data for every single program, but of the many, many programs that we can monitor, the market saturation in Vermont is much higher than most other states, even though that isn't a huge number. Of course, we're not a state with a huge population. So just, rule of thumb, sort of how are people using this? The average account balance is a little north of $8,000. Total assets under management are 7.9 million. And about a quarter of all the ABLE program users in the country choose to use the Ohio Stable program. So it's a very big piece of market share. Next slide. Rules to know. Before I do this, there was a question in chat and I wanted to just make sure that I address that. Okay. If your adult child is charged for room and board and receives SSDI, is there a limit to whether they can spend using a stable card to buy snacks when out in the community? Child is charged for room and board. I don't think there is. I can't imagine that there's a limit unless you imposed it as a guardian on how the stable card could be used. I think that's the right answer, but I'm also going to double check for you, Jen. Next slide. So here's some questions that come up. Is there a penalty if your account drops below $50? No, there is not. Can you ever overdraw your ABLE account? No, you cannot. You will just not be allowed to pull money out of it if you had a balance of 0. And do you have to pay taxes on money withdrawn from your ABLE account? No, you do not. Because either the money in your ABLE account is earned interest, in which case it is tax advantaged and not taxed, or taxes were paid on the money before you deposited it into the account. So grandma gives you a gift of $1,000 and she puts it in your ABLE account. She had to pay tax on that $1,000. Your dad puts in $500 a month. He's paying taxes on that $500 a month. You put some of your own earnings, you paid taxes on that. So the money that goes in there has already been taxed. So when you take it out, pay for something, you do not have to pay taxes again. It is not considered income reportable on your tax form. Next slide. So here's some more detailed areas for people to know about. A person can have any amount of ABLE savings and it will not affect, here are the lists of key federal programs that you're not gonna be told you aren't eligible because you have too much asset in your name. Student financial aid, your housing assistance through HUD, SNAP benefits, your food stamps, what we used to call food stamps, SSDI, Medicare, any type of Medicaid. So it's really every federal benefit program is not going to count your assets in an ABLE account. Next slide. There is, however, a cap on the total amount of money that you can put into an ABLE account. Currently, nobody in the Vermont system has nearly close to the cap. The cap differs from state to state, and it is identical to whatever your state caps for their 529 college savings accounts. That happens to be $482,000 in Vermont. There is no current account holder that has more than $100,000 in an ABLE account, at least according to my last monthly report. Next slide. So there is a reason to keep money below $100,000, and that is that If you go over $100,000, then SSI can be suspended. So it only works to protect you from that $2,000 cliff up to $100,000. And given that we're seeing a lot of people are using ABLE to avoid that $2,000 cliff. So this kind of makes sense that nobody in Vermont has gone over $100,000. The beneficiary's wages count as income. So again, that's just another way of saying that SSI can count what you earn as income. Income limits around SSI are not the same thing as asset limits, just to keep that distinction. And then here's a really, I don't know, they got to clean this up, but there's a really tricky rule that I really like to flag for people. If you hold on to the money from one calendar month to the next and then pay for housing, so say you take out $2,000 and you want to pay your rent. If you take it out on the last day of February and pay your rent on the second day of March, that expenditure is now counted as a resource by SSI. Okay, so just don't cross a calendar month. Take the money out on March 1st and pay the rent on March 2nd or the same day, but don't cross the calendar if you're spending money on housing. I don't know why that rule exists, but it can catch people up. Next slide. So Medicaid has to disregard all funds in an ABLE account when it determines the resources that you have around your eligibility. However, so that distributions from ABLE are not considered taxable income and are not counted as income in determining Medicaid eligibility as long as you spend them on qualified expenses. What's the downside with Medicaid? Here comes the slide. It's the clawback. Next slide. So I would really like to get this changed in the state of Vermont, but currently your state Medicaid authority is allowed to take back money that is in an ABLE account upon the beneficiary's death in order to pay itself back for the cost of some of the benefits that it paid out on the beneficiary's behalf when that beneficiary was alive. So currently the only state in the country that has disallowed the Medicaid clawback is Pennsylvania. But at some point it's on my to-do list to start trying to get our legislature to disallow the clawback in Vermont. This is a reason why you wouldn't necessarily put a ton of, like if you had a lot of money and you had the option of creating a trust, that's a safer place for a family to maintain an asset. But you might use an ABLE account as a complementary, more flexible option, but you wouldn't put a ton of money into it because of the Medicaid clawback. Next slide. The thing that's important to also notice is that if the beneficiary passes away, there are a lot of other expenses that have to be paid before Medicaid gets to claw back anything. So all the funeral and burial expenses are eligible expenses, all outstanding bills have to be paid. So often if you are planning appropriately, and of course we don't always plan somebody's passing away, but there isn't a lot of money left for Medicaid to claw. Money in a stable account is better protected from the Medicaid clawback than money is in a regular bank account. In a regular bank account, actually Medicaid can take a first bite at the apple as opposed to being the last one in line to claw back money. Next slide. Almost done here. So people often ask, is having an ABLE account better than having a special needs trust? They're just different animals, right? They complement each other. They're not really in competition with each other. So there are some benefits specific to ABLE that may be attractive to some families and individuals. The fact that it's established, administered, and owned by the individual with the disability. It is more flexible in terms of what you can spend the money on, particularly housing. It's easy to access. There's the tax benefit, and there's no separate complicated returns to file. So those are just some of the reasons people might want to have both or choose ABLE as a more appropriate type of account for what they have available to save. So I think that might be the last slide. Next one. Yep. I believe that also some of these resources have been pasted into the chat for you all, and I think the slides are going to be available to you. I always stress that one of the reasons we picked this Ohio program is there is an 800 number where an actual person will provide you with customer service. That doesn't happen in most other programs. And then the National ABLE Resource Center has wonderful, easy to follow videos that can give you additional information if you want that. And then the link for Vermont ABLE is also here. Next slide, which is, this is how you find the plan disclosure that I mentioned, that 113-page book. And then last slide has just got my contact information, which you're welcome to contact me with questions. If I can't answer them, because I will be very careful to make sure I'm giving you the right information, I will get you to the right person. So now I believe we are ready for questions.
Great. Thank you, Kirsten. Does anybody have any questions?
Oh, I see Jen. Hey, Jen.
Hi. I have a question. If your adult is receiving, let's say, SSDI versus SSI, I don't know if it makes a difference.
Mm-hmm.
And you have some extra money that you decide to use that public benefit and put it into your stable account.
Yeah.
Do you have to keep that money segregated so you know how much of the public benefit has been put into your stable account? Keep it separately in case you have to account for it at some point in the future? Or is an ABLE account just a savings account that you don't have to?
There's nothing in the ABLE rules that would require you to track that separate from any other type of money that you might put into an ABLE account. I'm not as familiar with SSI's requirements, but certainly ABLE wouldn't require you to track that separate.
All right, so I'll check with SSI. Thank you.
Yeah. Any other questions? Yeah,
I
go
have a
ahead.
few questions for you.
Great.
This might be getting into the weeds a bit, but going back to the 5 options and how the money can be invested, could someone choose to do both? Could they say, I'm going to put 50,000 here and the other 40 in the FDIC?
Absolutely. You could blend those options. In fact, you could choose to put 25 in a low risk Vanguard account and 25 in a high risk. You can mix and match. You can't change that distribution more than, I can't remember if it's once a year or twice a year. You can't like do it all the time. Like we just reconfigure how you want to distribute the money, but you can mix and match any combination within those 5 options. Does that make sense?
Yes, thank you. And I got one in the chat. What happens to funds in an ABLE account if the owner under the age of 18 passes away?
Good question. If the beneficiary, the owner, the person with the disability who's still a child, passes away, I still believe that the Medicaid clawback option would be something that happens. I'm assuming that individual died without a will because they're a child. But the money is still considered the child's property. The parent is probably the legal authorized representative. But if there were a significant amount of money in there, I would imagine that a probate court would have to decide after all the bills are paid, and undoubtedly the money would go to the parent, to the authorized legal representative. The money is even an underage person, it is still considered their property. Did that make sense?
Another question, what if someone was to go to the grocery store and they purchase their money and they use the stable account, they use their stable card, but in that grocery shopping, they purchase a bouquet of flowers to give mom for her birthday?
The chances of that ever getting found are almost zero, but it is technically not an authorized expense.
Should someone be saving receipts or deducting or somehow
The stable
documenting?
card will automatically save at a level of detail that would undoubtedly pass muster with an auditor. Like, they're not going to expect you to keep the Shaw's receipt if you were audited. So that's another reason why it really wouldn't be likely to be
Okay.
detected.
Okay,
But I mean, I'm not advising anybody to do something fraudulent. You know, if you want to be really careful about it, you could document all of that. There would be no expectation. I'm pretty confident in saying that there'd be no expectation other than the passive collection of documentation that the stable card allows for, that you would keep more detail than that.
and another question I had, you mentioned that Medicaid must disregard all funds in an ABLE account. So if I'm a parent and I'm filling out the Katie Beckett application, the waiver to access
Yep.
Medicaid for my child, do I list it or do I not even have to
Yeah.
put it on the application?
We've gone back and forth with the folks at Medicaid about that. I think that they are now sufficiently educated that listing it shouldn't be a problem. What a parent needs to know is Medicaid absolutely cannot, even though it's owned by the child, that asset cannot keep the child from getting a Katie Beckett waiver, Katie Beckett Medicaid. Last I checked, most people were, and Medicaid wanted us to tell people to disclose it, but be clear that Medicaid is making a serious mistake if it was to count that asset.
Those are all my questions. Are there any other
Awesome.
questions before we wrap it up?
All right, we're a little bit early, but that's great. As you said, you're always welcome to contact me if you have something that you need help with around ABLE. And we'll get you to the right place.
Thank you.
Great. Well, thank you so much, Kirsten, for this helpful information. You did such a nice job of explaining all of this. For everyone on, you will see a link to an evaluation in the chat. Please take a few minutes to complete it so that we can make improvements and fulfill our grant requirements. We do have many more interesting workshops coming up, and you can find details about those on the homepage of our website, VermontFamilyNetwork.org, along with the links to our previously recorded ones. We have tons of information on our website, and getting connected with us is easy. You can follow us on Facebook or join our closed Facebook page if you are a parent. We have 2 closed groups, one for all parents of children with disabilities and special healthcare needs, and one for those with adult children. You can also sign up for our monthly e-news or check out our YouTube channel. We're here to help. Please contact us by phone or email. And thanks again, everyone, and have a great day. Thanks again, Kirsten.
Yep. Have a great day, everybody. Bye-bye.